Hello everyone, this is Tyler with Massage AME. In this video, we're going to be talking about side lying position for prenatal massage. But first, I just wanted to talk a little bit about prenatal massage itself and why it should be done, and why, if you are an expecting mother, you should get a massage. Prenatal massage is crucial in the overall health of you yourself as the expecting mother, but it also has great effects on the child that you are carrying as well. If you're feeling good, well, then the infant is feeling good, the child, simply put. And that's what getting a prenatal massage, first and foremost, is about. It's just creating an overall sense of wellness. Furthermore, it helps manage pain problems that occur during pregnancy and discomforts and what have you. And furthermore, just getting a massage in general is always a good idea. Now, in regards to massage therapists themselves, the first thing I really want to say, first and foremost, is don't be afraid of pregnant people. I have heard this so many times in my practice of massage therapists being scared to work on pregnant women during their entire span as a therapist. I've heard it as far as, when they are first starting out, and also for people who've been doing it 20, maybe even 30 years. They've never bothered to work on a pregnant woman. They have never bothered to conduct themselves in a prenatal massage. I'm not sure why that is. I'm sure there's several reasons as to why people have their reservations about it, but I just want to say it right here, right now. Don't be afraid of it. You are doing a great service to the expecting mother. You are a part of this process of this life that is coming into this world, part of that whole journey. So do not be afraid and take the time to learn the things that are necessary to become not affluent, but the word I'm looking for, competent. There we go. Being competent as a therapist when conducting a prenatal massage. Uh, I would say, dare say, your massage isn't really going to change that much. There may be some adjustments you have to make with pressure. Of course, you have to be mindful of some areas of the body, the lower back, of course, especially the abdomen. We all know about some of the acupoints or in reflexology too. There's points around the wrists, points around the ankles. Of course, we have to be mindful of those things, but I've come to find that it's really more about your intent more than anything else. Now, a few thoughts and um, points of interest here, I'm sure, for the trimesters, things that may be going on and things that you may have to be aware of as a massage therapist, and also as an expecting mother, of course. In that first trimester, in 0 to 12 weeks, that is, the biggest concern that a lot of therapists have is it's volatile stage for the baby. The reason why is because we are working with blood flow. If I can say one thing about massage therapy, it's blood flow or circulation. And because of that, we are trying to avoid being party to possibly causing any mishaps like a miscarriage or anything of that nature. Because in those first 12 weeks of a pregnancy, that's that's when it's the most, like I said, volatile. We're not sure, is the baby going to keep? There's always a possibility that it could be rejected. So there are some therapists and even some businesses that will veer away from performing a massage in the first trimester to begin with. However, there are some therapists and businesses too that have provided consent forms, and so, if you are a practicing therapist and you do want to perform a massage in the first trimester, make sure you do have a consent form available to your client. However, it's not impossible. I'm not trying to say like you can't do this in the first trimester. I'm just saying there may be some causes for concern. In the second trimester, though, this is when it becomes a lot more safe, shall we say, and I'm using that term loosely, but that is when we are in our 13 to 28 weeks, the second trimester. And if if there is a table that is available to you as both the therapist and the client, you can lie face down as long as there is a cutout available for you in that table. Okay? Because when you're in your first trimester, you can usually lay face down or prone. You can lay face up supine in your normal massage. But in the second trimester, you need a table that is going to be set up specifically for you. So when you are lying face down in the prone position, there is a cutout both for your belly, and there's also two cutouts designed for breast tissue as well. And there also is a wedge that is typically used for back support when you are face up or in the supine position. I will show you a couple of photos of what those things look like here momentarily. And the third trimester, same deal. Um, if that table is available to you, you can still lay face down, lay face up. And I know oftentimes there are mothers that come in during their third trimester as they approach their due date. They hit that, you know, 38, 40 week time frame in their pregnancy, and they start asking for those specific acupoints to be worked on. That's at your discretion, just both to you as the mother and as a therapist. That's between you guys. Now, as you can see here, this table, yes, is specifically designed for a woman in her pregnancy beginning in her second trimester. It is designed so she can lie face down. Just you can see there's a center cut out there for the belly and also two right above for the breast tissue. The center is adjustable. It can be loosened, it can be tightened depending on the size of the prenatal girth. And this table, though, is not necessarily made for everybody. And we're going to talk more about that and the alternative, which is otherwise known as side lying position. We're going to talk about the importance of that position and why it is specifically designed for pregnant women or expecting mothers. And here we have that wedge I was talking about. It has that triangular shape. It's at an incline, so that way when you are working on an expecting mother who is lying in the supine position or face up, she doesn't have to be flat on her back. This can support her in that regard. Now, in side lying position, we want to make sure our model here, as you can see, she is properly supported. So you want to make sure you are doing this for your expecting mothers who may be a client of yours. If she's lying in side lying position, if she wants to have a pillow under her head to help support cervical alignment with the rest of her spine. You also want to ensure that there is a body pillow. You can use a head pillow too if necessary, but that it is between uh, her knees or thighs. Preferably, actually, you want that top leg to be residing over it, and that helps support proper hip alignment or pelvis alignment. Just helps the woman be in a better relaxed state. It removes as much tension as possible in this position. So here is our model now laying on her left side, and the left side is the most optimal for circulation, uh, and we want to make sure we are supporting proper circulation as best as we can during a massage. If she's laying on her right side, again, it's just not the optimal position for blood flow and circulation. The general rule for laying on the right side is 20 to 25 minutes. That is usually what most people will say. Now, obviously, you don't want her laying on her belly because of the undue pressure that would be placed upon the uterus and the baby that is in there. Also, it puts a lot of stress on the lower back for a woman to be face down. And also, in the face up position, in the supine position, it actually places undue or unnecessary pressure on the inferior vena cava, again, affecting that blood flow there. So again, the left side is the most optimal position. Now here we are going to demonstrate draping in the side lying position. When she's laying on her left side here, I'm going to show you how to drape the back in particular. So what you want to do is make sure that you're keeping everything close to the body. You want to drag everything. We don't want to pull up as to avoid exposure. Take that blanket, make sort of an L shape when you're starting out your drape there. The blanket is designed to add weight and stability for your drape with the sheet. Create that L shape, again, drag it along the body and tuck at the hip there, and now you have revealed the back. Again, take that blanket, tuck it there too for stability and extra support. It's weight, it also adds warmth as well, and you do your work, right? You can go about your business there. Working on the erectors, rhomboids, traps, QL. You can work on the shoulders, uh, so on and so forth. But yes, this is a great accessible um, drape to use even for the neck and for the arms as well. And again, now when you bring that drape back, just make sure you're dragging everything, nice and easy, keeping everything close to the body. She's in a very vulnerable position here, so we want to make sure that we are respecting her. Now, coming to the leg, she's on her left side. I'm going to show you on the right side also, but here's what you do, okay? You're going to lift up that blanket as you would in a normal drape. You're moving it diagonally up towards their head, and you do the same thing with the sheet. You grab one corner by the foot, one corner by the hip, pinch points rather, and you just move that drape up towards the head in a diagonal direction. Take a corner, I like to call them a bunny ear, and then lift her leg and bring it through underneath the leg there to create your drape. Bring up the sheet about halfway up the thigh, and then to finish that drape, take your blanket or a towel if you have one, and then tuck it underneath the sheet and continue rolling your way up in order to complete a full revealing of the leg. And there you can perform work on the thigh as well as on the cruce and also the foot. Here are a couple of shots to show you what that drape looks like on the thigh so you get a better view of it. And here we have a demonstration of how things look when she's laying on the right side, also so you can get a better view of the drape. Again, move up that blanket in a diagonal direction towards the head. Make sure you're keeping everything close to the body. Pinch at the hip. Pinch the sheet at the foot too. There's your 2 pinch points. Again, drag that drape up towards the head in a diagonal direction. You want to make sure you're keeping everything close to the body. Take that corner and you're going to slide it through right underneath her thigh there. That's going to create the beginning of your drape. Again, I like to call them a bunny ear. It's just something I like to say. It's easier to remember for students that I have taught. Drag it through, bring it up about halfway up the thigh. Now finish your drape by taking that blanket or a towel, if that's what you have available to you, tuck it underneath and finish rolling up that drape so you can fully reveal the thigh. And there you can work on the thigh, the cruce, the foot, and yes, you even have access to hip work here should your client want that. Always make sure you get that consent. Am I right? You know I'm right. Got it. Now, finally, my friends, therapists and clients alike, particularly our pregnant wonders that we have, just go get a massage. If you enjoyed this video, please like and subscribe, and feel free to leave comments on things you'd like to see in the future. Also, if anything you just want to mention about this video itself. Thank you so much for watching. Guys, it really does mean a lot to me. I put a lot of work into this stuff for you, and I hope to see you guys in the next video. Thank you.